surgical oncology. That was a fairly interesting concept discussion as well, meeting as well, was really looking at the need for developing surgical oncology services on the continent. And I think we sometimes forget that 80% of all cancer patients at some point in their treatment journey are going to require a surgical intervention. And surgery sort of encompasses the whole spectrum, whether it's from, diagnostics, where you're just using the, where you're maybe taking a biopsy. It can be preventative, where you're maybe have a precancerous lesion that we remove. It can be treatment where we excise a tumor completely, or it can be rehabilitative or palliative, where, for instance, we are doing a toilet mastectomy to improve your quality of life. So there's all these different aspects of surgical care. But however, there hasn't been really that concerted effort on the continent to really enhance the surgical services. And so again, there's a real need for surgical advocacy, and not just from, and we're saying the surgeons sometimes like ourselves need to move out of the OR and onto the table with the rest of the multidisciplinary team, because we know surgery is not a standalone process. Good surgery and good surgical oncology outcomes require excellent diagnostics, excellent pathology, whether it's in the form of, at least having access to immunohistochemistry, whether it's the diagnostics, whether it's in radiology to properly delineate the tumors and look at, the resectability of things. So it's the whole team that does need to be, the whole multidisciplinary team that does need to be strengthened, but there's clearly a need. I think we've seen quite a bit of progress in terms of the oncology, medical oncology and clinical oncology. I think surgical oncology has been lagging behind. There has been quite a bit of work, I would say, in West Africa, and Professor C.D. Carr was pleased to announce that we now are starting to see a collaboration between the West African College of Surgeons to really try and develop a robust surgical oncology curriculum that would help to at least improve the surgical workforce on the continent. One of the other great sessions that we had was really around the role of mHealth and mobile health and technologies in trying to leverage care in Africa. And we had great examples by Prof. Salako, just setting the stage of where we are currently in terms of the penetrance of mobile technology and on the continent, and then really getting key examples from Prof. Yates from Queens for her work in Tanzania, looking at cervical cancers, and Dr. Fidel Rubagumia looking at, with his project around using mobile health to detect skin lesions in patients with albinism who are at a slightly higher risk for skin cancers, and really looking at how do we practically apply these to the health systems. I talked briefly about really the role of clinical trials and how mHealth could potentially help to mitigate or at least enhance patient engagement in clinical trials and in oncology clinical trials in Africa. And what we did see is that in all of these, mHealth on its own is not a panacea for dysfunctional systems, right? The technology can only do so much, but even in terms of looking at all these technologies, there's a clear need for looking at what are the best, what are the successes, what are the things that sort of make mHealth or these technologies useful to the system. And what we've seen is that there's a clear need for, one, the usability, because if you're going to have a gadget that's really fiddly and that the health workers can't necessarily use, then that really doesn't help in enhancing or already stretched time that the health workers have. The other thing is also in the systems integration. We've had lots of little really quaint projects that stand alone, but how do these technologies or systems integrate into the pre-existing framework and help to bolster it? And I think that is a fundamental question that we do need to ask with all these strategies. Again, one does need to look to the governance of this. There is a lot of concerns around patient information and patient protection, information protection. And so really looking at what are the governance and structures around how these could be, how these could continue to get it evolved into systems. And really, I would say engaging stakeholders early goes a long way towards developing some of these strategies. Policy, again, matters. I would say, for instance, in Kenya, we've actually had a whole policy prepared around the conduct of mHealth and stuff, because keep in mind, mHealth sort of covers the whole spectrum. I mean, it can be just as simple as sending short text messages to a patient, come and pick up your medication, to more complex interventions. So we're having telemedicine or teleconsults, or to more complex matters where you're actually maybe guiding surgical procedures remotely. And so there's definitely lots of maybe having simulations of virtual reality. So it's basically a brave new world, and it is promising. But I think the whole idea is, as you said, really circling back to making sure that the patient's always at the center of that narrative. If we look at the potential in terms of getting increased patient engagement, we do see most countries, Kenya, for instance, has about 15% phone penetrance, in the sense that probably more than 100, because quite a number of people have multiple smart phones, and then about 66% smartphone coverage. And so looking at how do we leverage those to bolster the pre-existing systems in order to enhance the patient health worker engagement, and in order to ultimately empower our patients to take charge of their health and really have us as partners in their healthcare.